You'll see it at the top left hand of your screen that we are officially recording. So just to cover just a few things, my name is Kyle Tribble. I serve as Community Relations Manager for Your Way Home. If you have not received the email from me this week in regards to your street outreach assignment and your team, please feel free to check out the survey in the link in the comment box. I'll be sure to put that in as soon as I finish, and I'll be able to answer any questions throughout the chat as well. And I will pass it on to the rest of the team. It's up to you, Michaela.
All right. Hi, guys. Can you confirm that you see my PowerPoint? Or do you see my weird presenter mode?
Yeah, we see it, but it'd be good if you could zoom in a little bit.
Give me 1 second.
We need the over better? 50 font. Yep, that's an over 50 font. That's good.
The House of Representatives impeached Trump a second time for inciting the insurrection.
So, as a reminder, this is our point in time count training. This is sort of our agenda for today. Kyle just welcomed us all. I am Michaela Lampert. I am the Housing and Homeless Services Program Manager here at Your Way Home. So I will be doing most of the presenting today. We will pass on to some other members as we go through. To begin with, sort of Your Way Home in a nutshell is a public-private partnership whose mission is to ensure that everybody who lives, works, learns, and invests in Montgomery County has an equal opportunity to live in an affordable home in a thriving community. We are here to try to help all Montgomery County residents live safely and comfortably in their communities. The point in time count, which is what we're all here to learn about today, is a count of both the sheltered and unsheltered people experiencing homelessness on a single night in January. It is a HUD required count that we report back to the federal government. HUD requires that continuums of care conduct this annual count, and it's up to each COC to plan and coordinate how that count looks locally. And for some background information, the continuum of care is the governing or the body that governs and decides sort of what housing and homeless services look like for each community. And within Montgomery County, Your Way Home is the lead agency for that continuum of care. If anybody is interested in joining that continuum of care, you can reach out to Kyle and he can get you a survey so you can get on our mailing list and participate in any of those events. In Montgomery County, the sheltered count includes all emergency shelters and transitional housing locations, and the unsheltered count will take place at the predetermined locations that you should have gotten from Kyle throughout the county. We collect data at the point in time count to sort of determine where those in our community who are unsheltered are, and to learn how many of those who are surveyed are what is considered chronic homeless. And chronic homelessness is defined as a disabled individual who has been living in a place not meant for habitation for 1 year consecutively, or 4 times equaling 1 year within the last 3-year period. And we also collect data to figure out the best interventions for people who have recently become homeless, who have become homeless or are on the verge of experiencing homelessness, and to try to prevent further instances of chronic homelessness. It helps us plan for future services and identify maybe some unmet needs within our community. And it's also a good opportunity to raise public awareness and engage different members of our community within the homeless system and sort of provide some community education. There are 2 sort of different types of benefits to an accurate PIT count, and there are some local community needs and some HUD needs that we are trying to meet here. From a local level, it's important to help us make the right funding recommendations to our elected officials so that we can best meet any of those needs that we may have identified on the night of a PIT count. It helps us determine the size and the scope of homelessness at a local level, determine how many people are experiencing homelessness in our community, to track trends within that population so we can see if there's anything that is affecting homelessness, that might be leading to homelessness, and to plan our programming and our services accordingly so that we can best address those local needs, and to measure our progress, to measure how things are changing or improving throughout the course of time, and to look at the performances of all of the individual programs that serve within the system and the system as a whole. And then from the federal level to HUD, they need this data to understand the extent and nature of homelessness throughout the country and not just within Montgomery County. And like we make recommendations to our local elected officials, they provide this information to Congress, who can help meet service gaps and provide additional services. And they report to Congress on the performance of all of the different programming that exists. And HUD also uses it to help make their own sort of large scale funding decisions. So we are here to talk today about the unsheltered PIT count, which is the count of those who are currently in a place not meant for habitation. And the unsheltered count is a survey that you will be giving, and each question is voluntary. So if a person doesn't want to answer a particular question, that is their choice. They are not expected to. As you are giving this survey, make sure you follow your script closely so that you avoid any miscommunications or issues. And a person's refusal to respond is not a denial of service. So you'll go out with some winter gear with the offer of going into a shelter for the night. If they refuse to interact and refuse a service or a survey, that does not mean that they're not eligible for anything else. No questions should be posed or recorded regarding medical or health information, the severity of one's disability. You don't have to ask about the specifics of those disabilities. And if they don't wish to be interviewed, but your team can confirm that they are homeless, you can see their homeless status, you can complete an observational survey instead of asking them all of the provided questions. And when I pass it off to Jim at the end of this slide, he will go over what an observational survey is. And then if you encounter a person who needs immediate assistance, if it's an emergency, please call 911. But if it's more, if it can be responded to with less urgency, we're going to ask that you contact the command center, which is something that we'll talk about here in a couple slides. So for now, I will pass it off to Jim, who will talk about the survey.
Michaela, if you unshare, I'll be able to take over control. Okay, so on your screens, you should see a live demonstration of the survey. If anyone does not see it, stop me. Otherwise, I'm going to continue with what you'll see the night of the count. This is a survey form. It's Survey 123. It's an ArcGIS platform. Each team is going to be provided with one iPad, but you may also use a personal or work mobile device so long as it has internet connectivity. Everything that you see will be accessed via a web browser. Given that this is our first experience using this technology in the field, we're asking that each team also have a member complete a paper survey in parallel with what you fill out on the device. This is simply so we don't run into an issue where the effort of the night is gone should we run into any technical issues that we can't account for. However, if you're able to complete the survey and get a successful message at the end, you can assume it was successful. This is just for our own purpose and backup. If your county issued iPad does stop working, as we said, you can use a mobile phone or anything that you may have on your person to access the survey. And if all technology is failing for you, then you just use the paper as your source. For data quality purposes, volunteers must complete the survey. Please do not ask the consumer to do it. And as you fill it out, we're going to have a question that requires the first three initials of the first and last name of the person you're speaking with in order to verify that person's identity, whether they're in the HMIS database, and to provide information to our street outreach workers to verify their homeless status after the count. Be sure to enter location information for each completed survey as thoroughly as possible. Each device will have the URL saved on it. We'll also be handing out QR codes that can be used by whatever device camera you have. Just hover over with the camera and it should give you a hyperlink to be able to access the server. It's a context-based form. So as you fill it out, any relevant questions are going to be populated. So right now you only see 2 responses. I'll begin showing here as I type in my name as the surveyor, and then you'll follow the questions as you see them. Are you able to observe the presence of any homeless individuals in this location? Since you'll be provided with a predefined list of locations, we're also asking that if you come to one of those sites and you do not observe anyone, that you answer no, so we can also collect for analysis later how our teams have been in the field. When you answer no, you'll be presented with this map. You can either type in an address here, or on the left side, there's a little circular target logo that will find the device location. And if it's not perfectly accurate, which it may or may not be, use the context available in the map to locate as precisely as you can. We have a big map option up in the upper right that gives you an imagery or imagery hybrid option that you can change to. So if you're in a shopping center and you can just zoom in. With this, you'll be able to do pinch and zoom on a tablet, and then single finger to drag, then just tap, place the location that you're at, and then hit submit for that if there's no one there. Now, if there is someone available, you answer yes, and you'll see the other questions begin to reveal themselves. Is the person in a shelter, yes or no? If it's a yes, we also have this pick list of shelters. Some of these are HMIS affiliated and some are not. So if there is an HMIS affiliation, you'll be given this response. Because this person is sheltered in a participating shelter, they will be surveyed later in a sheltered count and should not be interviewed at this time. Again, please mark the location on the map where you are and submit. And if it's not affiliated, you'll continue with the survey. So you can continue to here. This is where are you able to survey this person comes to whether you'll be doing an interview or an observational survey. So if it's yes, you can go on to this question. If it's no, this is where you'll just jump into the questions to the best of your knowledge, observing the situation as you see it. So we'll go to yes. You can ask them, can I have 10 minutes of your time? They say yes. If you answer no here, again, you'll complete an observational survey. For the purpose here, we'll continue with yes. Did another volunteer or survey worker already ask you questions? If it's yes, that you can end your survey there. Again, mark your location, please, and hit submit. And then if it's no, you'll come to these questions here. There are 3 sort of cohort questions, about the person in the household that they're with. As you populate these, if we say there's 1 adult and 2 children, you'll see that there are 3 bubbles that come up here under household questions. Each of these will need to be filled out completely for the household that you're speaking with. And please complete them in order of oldest to youngest. If the other household members are not present, the original respondent should answer for them. And we do not have 22 children. Excuse me. I may need to refresh this. It appears it may have become unresponsive. So quickly go through. I received a message from the meeting there that it was unresponsive. So fill these all out as quickly as it can. Here you'll also be given where someone may be sleeping. Okay, so we're back to this part. We'll say 1 adult and then 1 child here. So you enter the first 3 letters of their last name of their name here. If they only have 2 characters in their name, only fill out 2. You don't have to put in any additional characters there to reach the 3 limit. If they don't know or they refuse, just type don't know or refuse, please. And for person 1, you can skip this, but then for the household, you'll say how are they related? How old are they? Enter that. Some demographic questions. Fill these out as completely as possible. And some questions related to service. Now, whether they were a National Guard reservist. First time, is this the first time they've experienced homeless? Yes, no, don't know. So let's say yes here. Here you'll pick a time period of days or years for how long they've experienced homelessness. Say 2 days. How long, or where did you have your last permanent residence? You can either select institution. If you select residence here, please fill in as complete address as possible. So we'll say 123 Main Street, Orange Ford. Yeah. And then only ask the following questions. The person's 18 and older. Have any of the following kept you from holding a job or living in stable housing? Excuse me. Select all that apply. Does this person need immediate assistance? For here, we'll say no. And then again, please mark your location on the map and refine or possible. And then you'll come to the end. That's all the questions I have for you. And you can submit. And since I didn't fill out the second member of the household, it gave me an error to go back and fill in for the child that is in that household. So if you do come to a situation where you forget, you try to submit. If there's a required question that's not populated, it will bring you back here. And you can jump back and forth between person 1 or person 2 there. So let's say, and we'll say child, so 12 years old. Again, this similar demographic questions. Please fill as completely all that apply, whether it's their first time experiencing homelessness and how many times have they experienced. So again, these are all context-based based on your response. Again, fill out this address if it comes up, whether they need immediate assistance or not, and submit. And when it successfully submits, it'll say, great, your data was sent successfully, thanks. And there's a hyperlink here to return for your next survey. And that's all for that. I'm going to head back to, Michaela, I'm going to escape. If you could go back to the slides and slide 11, please. Or actually slide 12. So here, just some notes about the survey that we had already gone over. So if you could jump to slide 12, please. So in this case of your device location, if you're trying to use the widget and you're finding that it's very inaccurate on the iPads, this is the steps you would take to make sure. We should have this prepared ahead of time, but if for some reason it does not, or if you have an iPhone, have good location, go to your settings, privacy, location services, and then it's Safari websites options, and while making sure that your location is being used while using the app and that precise location is turned on, that should give you the most precise location available. And critical data components to remember, the 2 most important data related considerations for a PIT count worker when speaking with a client are having a discussion about the person's homeless status, such as where do you plan to sleep tonight, and collecting as much data as possible. And with that, I will hand it back to Michaela.
Thanks, Jim. So just a few points that I think Kaylee was mentioning in the chat that I wanted to make sure we go over is that clients are able, people you are interviewing are able to refuse any questions. If they decide to stop mid-survey, you can select client refused or data not collected and complete the survey with as much data as you were able to collect. None of this is required. None of this is an expectation. To switch gears a little. Hold on. Technical difficulties. Okay. All right, so the next thing that we're going to talk about is the command center, which is sort of our base, our home base for the count. So Dennis Miller, who is actually in training today from Veterans Affairs, will be sort of in charge of the command center. There will be several other people there with him. The command center is there to help you continue canvassing and provide you guidance should you encounter someone out who needs help. It's supposed to take the pressure off of you to be able to continue your count if there's a situation that arises that takes some time to resolve. The team leads are the primary contact for the command center. They're responsible for all of the needs that might come up throughout the night, for getting in touch and communicating those needs effectively. Some reasons where you have to contact the command center include checking in and checking out at the end of the night. We expect you guys to let us know who is on your team, where you are canvassing, what your plan is, and also to let us know when you're done, when you have completed your canvas and you are checking out for the night. Should you encounter someone who needs transportation to shelter, should you find someone who is interested in receiving a COVID vaccine at a later date, and in the event of an emergency, and if you find someone who needs Spanish translation services, there will be someone at the command center who's able to help with that over the phone. If you have any other questions throughout the night, any other worries or issues, please don't hesitate to reach out while you're canvassing. We're there to help. All Montgomery County Code Blue shelters are open the night of the count, and we will provide transportation. The command center will help arrange that transportation. If you find someone who's interested in going to that shelter, contact the command center. We will arrange that transportation. We'll ask that you provide some details about that person who needs transportation. So some identifying features for them, their name, their physical description, and some specifics about where they need to be picked up, so that when transportation is dispatched, they know where that person needs to be met. If they refuse the shelter but would like to be connected to your way home with our street outreach team the next day, you can provide them with the contact information for the street outreach team and ask them if they're interested. And then that information will be given to the street outreach team, who will make those connections the next day. To review, sort of keeping in contact, it's absolutely important that you let the command center know at the start and the end of your count. Let us know you're out, we're done. Command center staff will contact all team leads to ensure that all volunteers are accounted for if we don't hear from you. And team leads should remain in contact with the rest of the members of your team, because some of you have never done this before. And our team leads are people who have experience, who are able to guide you through the process of the PIT count and help you connect and learn and take the most away from this experience as you can. If you encounter a life-threatening emergency, again, please call 911. If you find a crisis situation, contact the command center, who will be able to communicate that crisis to the street outreach team appropriately. Some potential crises might be a family with children who's experiencing homelessness, or an unaccompanied minor who's experiencing homelessness. We would like to know about them. You will receive the night of the count contact information for all of your team members, the command center, and for your team leads. So you will have all of that with you the night that you go out for your count.
Hey, Michaela, this is Dennis. Speaking of people who have never done this before, Dennis Miller has never done this before, so this is all new to me. I'm here to learn, and it'll be a learning experience at night. I've done a lot of command center work. I've done a lot of operations like this over the years, and I just wanted to pass on that the person in time count, if you look at it backwards, it's not necessarily about the count. It's not even necessarily about getting it done on time. The first word in PIT count is person, right? PIT count, person and time count. This is going to be a great night. We're going to reach a lot of people. We're going to get that data using Jim Reblis's magic on ArcGIS. We're going to go to all that stuff, but we're going to reach a lot of people. We're going to get a lot of people connected to services. It's going to be great. But
Thanks,
remember,
Dennis.
the first part of PIT count is person. That's the most important thing. Some of these people are really needy because they have a lot of needs. But again, call the command center with stuff like that. We just want to keep the teams moving. Otherwise, the sun will be coming up. We'll still have work to do. But thank you.
Thank Dennis. We appreciate you volunteering to help us out. Switching gears just a little bit, we want to make sure that everybody is safe with regards to COVID. So we ask that all the volunteers wear a mask for the duration of the PIT count, regardless of your vaccination status. We expect you to be masked both indoors and outdoors. If you don't have a mask or you don't have one that you feel safe in, we can get one for you. Before the night of the count, please conduct self-screening. If you're experiencing any kind of COVID symptoms, stay home, contact us, let us know that you're not going to be participating. We would rather be safe than sorry here. The night of the count, you'll be both walking and driving. So if you choose to ride together and carpool, practice COVID safety in your vehicle as much as you can. Keep your mask on while you're in the car together. And if it's safe, open the windows a little bit. We understand it's going to be cold, so that might not be possible, but in the event that it is, please do so if you're able. It's important to keep an appropriate distance in general when conducting interviews during a PIT count. The street outreach team will talk about this a little more later, but you are entering what is someone's home, so it's important to be respectful of that. But it's especially important in times of public crisis like COVID. So maintain appropriate social distancing when you are conducting those interviews. Offer interviewees a mask. We will get them to you to distribute that night. The Department of Public Health was able to get us some masks. If someone refuses to wear a mask, you can continue with this interview if you're able to keep a distance that you feel safe and comfortable with. We expect it to be at least 6 feet. If you're not able to keep that form of distance and the person you are speaking to isn't interested in wearing a mask, thank them for their time and complete an observational survey instead. We cannot force anybody to wear a mask, just like we cannot force anybody to participate in a survey. So ask, move forward safely from there. There will be teams of EMTs out who will be able to offer COVID vaccines, boosters, and flu shots to those interviewed on the night of the count. Those teams will be in Norristown, Pottstown, and Willow Grove, Abington area. Should you encounter someone who is interested in a vaccine, but you are not with the paramedic team, please reach out to the command center who will be able to dispatch the paramedics to your location. You're going to need the same kind of identification data that you provided for those who are interested in street outreach follow-up. Name, form of contact if they have a phone, where to find them, things of that sort. Similar, if you find someone interested in receiving a vaccine the next day, please report that out to us, and we can get that data to the paramedic teams who can go out and meet them the next day or later in the week whenever they feel comfortable doing so. The vaccines are also open and available to you. So if as a volunteer you are interested in getting a vaccine on the night of the PIT count, we will get a registration link out to you guys as soon as we're able. We ask if possible to complete that registration and let them know what vaccine you're interested in. They have all 3 brands of vaccinations and approved boosters. If you're getting a booster, make sure you bring your vaccine card from your initial doses. Also make sure you have any other documentation that you're asked to bring. I think you also need an ID. And then I will pass this on to the street outreach team. I don't know, Mark or Colleen, I don't know which one of you is here to present today.
It's me. Hi, it's Mark. I'm here.
Hi, Mark. Just let me know when you're ready to go to the next slide.
Yeah,
okay?
just go to the next slide. Okay, I hadn't seen this slide before. I'm just checking it in. It's not one that I had seen before, but each team's going to have a street outreach worker in it. And so those folks will be sort of aware of the space that you're in. And if you're contacting it, when you're with your group, just make sure that you've exchanged all of the information that you need, your phone numbers and everything, so that you can we can make sure that you're in touch with within your own group. And then it says weather and terrain. It's been cold. And it probably will be cold the night of the pit count. So long johns and sensible heels, please. You're going to be out walking in different kinds of terrain probably. So just be prepared within what you've brought for yourself. Yeah, just don't take pictures. Don't. It's been said a couple of times, the person themselves is the most important. And there's another slide that talks about engaging, and we'll get to that in a second. But respect space. So it's important that we remember how this lands on the person that's we're talking to. We're either going to meet somebody who's out on the street, who's probably on their way to something, so we're stopping them and we're asking them for their time, or we're meeting at somebody at their house. It's a tent or it's a space that's theirs, and we're actually later in the evening we'll actually be sort of in their bedroom, like we're going to be right there. So we should be respectful in terms of space. Don't shine a flashlight directly in somebody's eyes, even though we'll need to have a light probably for most of that time. Don't go off on your own. So stay within eyesight of each other at all times, and make sure that your team leader knows that you're with the group. And if you're not feeling comfortable for any reason, don't go farther, and let somebody know. So that's sort of the teamwork part of it. This is going to be new for some of us, and it's going to put you a little bit out maybe of your comfort zone, but it's important that we stay in communication with each other about how we're doing. And it's great to ask each other questions about, I'm not sure what to do here, and can you help me out? Go ahead and go to the next slide, maybe, Michaela. Yeah, this is the one that I expected. It's just, remember that this is us having a conversation with a human being who's in a hard spot. It's struggling a little bit. So explaining who you are, and how we have kits to give out to each person. So we're offering them something. I have some things for here for you tonight. Is it okay if we have a little bit of a conversation? If I ask you some questions, I'm with the pit count. But just being respectful, like you would knock on a door if you're going neighborhood to neighborhood. If you were knocking on a door, you'd stand back if somebody would come to the door, and you just have a polite conversation about who you are and what you're trying to do. Respect the fact that somebody might not want to have much of a conversation with you. We've already reviewed the survey, but it's important that you sort of know what's in the survey, so that you know how to sort of have it as easily and as conversationally as possible. The big thing is just remember that this is a person who's struggling, and you're in their space. So just to offer what you have to offer them. Say that if they would like a vaccination, or if they need some medical support, that's available. And also if they would like to go into a shelter, that can be arranged. You should know sort of behind the scenes that that's a hard decision for somebody to make. How do I get there? How do I get back? We'll offer transportation, but a lot of times you're asking somebody if they want to leave their space. Lots of times people don't want to leave their belongings because they're afraid that they'll be stolen. So there's lots of reasons for somebody to be hesitant with that. So, but you're going to offer that and just see what they want to do. Next slide. Is there one more? There's a question in the chat. If they have stuff, can they bring their belongings to the shelter? You can usually bring some things, like what you can get into a book bag. And so people can bring small items. You just can't bring a lot. And so that's usually the question mark for people is do I have other things in my tent that I think will be okay until I get back? Each team leader will have the list of known locations. And again, the street outreach team is going to be spread out between all of the locations. And so that team has experience with the folks who are out there. And so they will be able to guide you, the teams, through different spaces. And these are the places that you would sort of expect. Sometimes the campgrounds are out of sight, or the tents are out of sight. Cars, there's a lot of cars that are in Walmart parking lots. That's a common spot that we've seen this year. And so if you're coming up on a car, just be very, very careful. Don't come up abruptly, come from the front of the car so people can see you. It's kind of frightening if you're sort of settled in for the night, to have somebody knock on the window. You're afraid that you're going to be told that you have to leave. So just be very careful when you're approaching a vehicle. And you see on the slide the other locations, and so each team will have a list of locations with them. I think that's, go ahead, Michaela, do you have something? Oh, okay, there we go. Yeah, the locations that are 24-hour ones, McDonald's, Burger King's, Walmart, are places where people stay. And so those are good places to focus on. We just talked about the usual precaution: come from the front, don't come from the side, and come from a distance and sort of announce yourself while you're still pretty far away. Michaela did mention, the COVID COVID spacing, but I would also just say, for the purposes of this kind of an interview, you don't want to be in 6 feet anyway. You should be 10 feet away from a person and talking to them from that space, unless they welcome you in a little farther. If they're standing on a street corner and you can come in a little closer, fine. I would just stay absolutely 6 or 10 feet away from somebody. And then the need to obtain key information. So if you see something like a car or some identifying piece of information, it's important to note that. Then that's for the street outreach team to know how to find a person if they're going to follow up. I will also just say that our experience over the last couple of years has been that there are some people that are not known to us that we find on the pit count night, but there's many people who the street outreach team is already aware of and familiar with. So that makes it a little bit easier when we know somebody. But it's important, if we're finding somebody who's not known to us, that the street outreach team has that information. So all the identifying information. Is that it, Michaela? Okay.
Yep, that's all. Thanks, Mark.
One other thing I'm seeing in the chat is just reflector vests and that kind of thing. You should have a flashlight. I don't know if we're handing them out to people, but you should have a light, and you should have clothing that can be seen.
We will also provide lanyards.
Mm-hmm.
Believe that's all. So you will have identification on you that says you are with the pit count. We're not going to just send you out with nothing. So on the night of, these are the areas that we have identified where volunteers will search. Please know that not all teams will find someone experiencing homelessness on the night of the count, and we are hoping to use this experience to expand our efforts and to locate people, like Mark said, who we may not have known about before. You should have already received your meeting location from Kyle. If you didn't, make sure you complete that survey that he dropped in the chat at the beginning of our training. Just as a review, the catchment areas are Abington, Willow Grove, Ambler, Cheltenham, Ardmore, Lower Merion, Lansdale, Sodderton, the Norristown area, Norristown, Bridgeport, King of Prussia, and the Pottstown area, Pottstown, Royersford, and Pennsburg. We have identified team leads for each of those areas, and there is a team lead for each of the smaller areas of identified locations. So once you arrive at your meeting point on the night of the count, you will break up into smaller groups. Each group will have a team lead with them. You will check in with the command center and you will set off in whatever way you decide to do that. That is entirely up to you. Your team lead will have all of your gear, all of the necessities with them when you meet up. So your responsibilities moving forward in the PIT count are to meet at your assigned meeting point in your geographic area on the night of the 25th at 6. You will be out from 6 till 10 p.m. Make sure that you're willing to help drive or provide directions to the driver if that's how your team decides to move about. Introduce yourself, introduce your group members, and explain sort of the purpose of the count, why you're out, what we're doing. When you are attempting to engage in homeless individuals, it's important that they know who you are and you're not just a stranger who's coming upon them and asking them all of these personally identifying questions about themselves. With the participants' permission, complete the survey form from each encounter. As a reminder, the survey is digital. You will have an iPad on your team, but we also ask that another team member also completes the survey on paper while the person is being interviewed. You don't have to interview them twice. We just want to have some backup just in case. Please make sure you are following all COVID safety policies. Keep your distance. Always wear your mask. You'll get masks when you arrive if you need one. And then make sure you thank participants for their time. Thank them for talking to you and spending time with you that night. Offer any support, cold weather supplies, there's snacks in the bags, transportation to shelters, anything of that sort. And just be cordial, be personable. Thank people for their times. So your action steps until the night of the count include making sure that you know where you're meeting people. If you don't have your location assignment yet, complete that survey. If you've already completed the survey, please email Kyle or myself. Look at the survey that is emailed to you. You should have a paper version of it ahead of time so that you're comfortable with the questions and you can develop some sensitive ways to ask those questions if you are the one who ends up doing the interviews. And like Mark talked about, make sure you're dressing casually and appropriately. It's going to be cold, so we will need warm weather gear and good comfy shoes. Please don't wear heels. And make sure you get there on time. And a timely departure is important here. And then your team leaders will have the following when you arrive. They will have the iPad, they will have paper versions of the survey, they will have the supply bags to be distributed, contact information for everybody on the team, and the QR code to access the survey from any device with digital data. As all volunteers, we ask you come prepared with the cell phone that has a charge on it so we can contact you in the event of an emergency, comfortable clothes. Remember, we're walking, an openness to the experience and willingness to learn and participate and experience something you may have never done before, and a writing utensil in the event that you end up completing paper surveys. And that is all I have. I know there's a lot happening in the chat that I have admittedly not seen. So are there any questions that we need to immediately address?
My name is Veronica, and I'm from Shiloh Missionary Baptist Church. We have some hats and gloves and socks. Who do I give them to ahead of time, or how are we able to distribute them or give them out to people?
Kyle, should Veronica reach out to you?
Yeah, sure. Veronica, you can always shoot me an email. I'll be able to pick up all the donated items for the night of the pit. So I'll put my email in the chat again. Thank you.
Okay, great. Thank you so much.
I just dropped my email. If you have questions, you are welcome to email that as well. Norm, we can email this PowerPoint out. You will also have access to the video recording of the training if you would like that as well. Any other questions? If you have questions after we leave, feel free to email me or Kyle and we can get you situated. If you don't have your meeting location yet, make sure you've completed that survey. Otherwise, it looks like we can get you 15 minutes of your morning back. Thank you all for joining us and have a lovely, lovely day. Kyle, this is your
Thank you.
reminder to stop the recording.